So welcome. It's a little after 8. It's good to see everyone here at the intersection. We're going to take just a few announcements to allow time for people to enter. Um, so let's see. Next thing that's coming up in our world, somebody's going to have to jog my memory this morning. Um, I think it's just that taxes aren't done by any means, but April 15th has passed. So, yay to that. And we're looking into Fiesta. And I'm not even sure what I'm looking at yet in terms of Fiesta, other than knowing the Battle of Flowers Day, which always is an anomaly in terms of the name of that parade for me. But anyway, here we are at Fiesta time in San Antonio. Does anybody have any announcements of upcoming things that you'd like to highlight? If not, then I'm going to mention that we are working our way into or looking our way into May, which is Mental Health Month. And so this coming month, today starts a series where we'll be looking at health and mental health at the intersection. With that, then on May 21st, we'll have the next Sacred Action Lab, which will be on mental health. Following that, CHCS, Bexar County Behavioral Health, Mental Health Conference, I believe is May 29th, off the top of my head. All good work that's being done here in the county and in the city where we're working together. People really working hard. We got some great plans coming for Pathways to Hope in August. So we've got some real synergy going. We've been working at it for years, but it's really, I think, taking some solid form and movement. So keep those things on your calendars and keep those in mind. I'm going to ask one more time in case there's another announcement anybody has. We've already got a pretty good turnout of registrations for May 21st. Bill, what does that look like right now?
It's looking at about almost 40 already, a month in advance. So I'll
Mhm.
put the link in the registration link in the chat so everybody can see. You can see kind of the agenda that's focusing out. It's going to be held. It's in partnership with NAMI, and so it's going to be held at the at their meeting space that they use for their quarterly meetings, which is the Covenant Presbyterian Church up at I want to say it's West Avenue and 410, right in there. And so, but that'll be on the link, and some great presentations from big names. UT Health is going to be there. We've got community liaisons from Johnson and Johnson, the big pharma company, if you can believe that they have community liaisons in mental health. Surprise, they do. And so they're coming, and this really cool track coming around on how to train your non-program delivery staff on awareness and de-escalation, something that UT Health is doing. And so we're going to see if we can get people to talk about that, which is a really interesting thing that they're doing. So it's going to be very cool. So I hope that everybody can make it. And I'll put a link in the chat.
Thanks,
Yeah,
Bill.
Bill, the Covenant Presbyterian Church is located on the access road just west of Blanco. So
Okay.
it's not, and West Avenue doesn't intersect there, but it's easy to find. It's right on the access road.
Yeah. Thank you, Doug. There's a map. There'll be a map. Don't rely on any of my directions. Use the map. Thank you, Doug.
And we want to thank Dr. Woo for coming this morning with just like 2 days' notice or whatever. Bless her heart. She was so kind to me. And I'm like, we really want to start this series with, just a little bit larger picture and what it all sits in. And some of you will remember, and we sent it out yesterday with the notice, but that Liz Letts brought the every 3-year assessment to us in January. Well, what Dr. Wu is bringing us this morning was just presented to City Council last week, but it's the action plan that follows that assessment. And as you know, our whole plan this year in particular is moving into action. And so the Sacred Action Labs, how do we put all of this to work? So thank you, Junda, for coming this morning, stepping up. utilizing this. And I want to remind everybody this is being recorded. So you'll be able to take this to your teams and congregations, organizations, and be able to run this 15-minute-ish presentation on what the plan is. So it's all yours, Dr. Wu.
Thank you, and thank you so much for inviting me, and for anybody who's already seen this, because we did present it last week, but we're going to do a shorter version today. Apologies for having to sit through it again, I guess. Definitely, if you didn't see Liz's presentation, go back and take a look at that January one, because there's a whole world of data. You know, the health department gets a lot of requests for data, and a lot of times we do end up referring people back to, for instance, the Bear Data Dive, or the Community Health Needs Assessment. So take a look at that. But then, yes, as Anne said, we've got the information. What are we going to do with it? Am I able to, is this not rolling for me? Okay, there we go.
There you go.
So I just first a step back. We know that the structural reasons for a lot of the outcomes that we're seeing are poverty, disinvestment, structural racism, redlining, right? Those root causes of health. So what you're going to see when we talk about the action plans are some root causes that cut across a lot of the outcomes that we're seeing. And that requires systems change. It's not easy or fast, but we have some examples of where we as a community in San Antonio have done it before. This is required for accreditation that a local public health department takes part in both the Community Health Needs Assessment, which you might hear us call a CHNA, as well as a Community Health Improvement Plan, which we'll say CHIP for. And I'll just talked about the CHNA. The CHIP is the plan, and you might have noticed that the CHNA came out in, oh, I went backward, or meant to go backward, came out in October 25. So the little image on there says 25. And now we've got a CHIP that says 2024. And I just told you one is supposed to follow the other. So to be transparent, we got out of sync. You know, it's been a little bit, post-pandemic, and for a lot of different reasons, we got out of sync. And so we're going to extend this current CHIP to sync up with the next CHNA more appropriately. Meanwhile, we've been taking the CHNA information to all of the existing work groups. You might think, well, okay, hold on. Sorry. I'm going to talk about the existing work groups in a few slides. But first of all, in the next few slides, you're going to see some examples of metrics. And again, remember I said that population change is slow and takes time. You might be used to seeing metrics where like, oh, we're going to decrease something by, 30%. You're going to see very small measures because we're talking about the whole population. If you look at what we sometimes call a population egg in my team on the right here. So we're not talking about a number of clients or something. We're talking about all of Bexar County, right? So with all of that prefaced, the 4 areas that the Health Collaborative strategic, steering committee worked on to parcel out, I guess, along with input from not only steering committee members, but based on the information in the CHNA, based on some focus groups, based on some intentionally small groups of experts. What it turned out to be is that these are the 4 areas that our community feels that we want to concentrate on and that can move the needle on some of the other issues. I hope that these 4 generally make sense to people on the call, that this is something that we feel like people have been, it hasn't changed a lot in the last, I don't know how many years, for many years now, right? I mean, you could even throw in there poverty because that's an underlying root cause for the food and housing stability issues. So now moving to action. starting with behavioral health and mental well-being, right? Because that underpins so much of housing stability, as well as just general community wellness and economic potential of our community. So the drilling down, we decided that normalizing help seeking and reducing stigma would be very powerful, especially for marginalized communities, strengthening the capacity and effectiveness of our mental health workforce, which has actually been improving a lot. And some of that is due to statewide changes and support for the workforce, for loan repayment. So here we're looking for an increase in the population reporting fewer than 5 days of poor mental health, which is a something that's collected routinely through a survey from the CDC called the BRFSS. And there are a few different ways in which they're doing that, but this particular slide highlights a coalition that is working on substance use and some other partners for the substance use work, specifically looking for ways that outreach workers can more can be more aligned in how they're collecting data and on how their policies are, so that we have a little more uniformity and professionalism in this group. Food security. So some of you might know about the Health Equity Network, which is a collective impact coalition that Metro Health has been providing backbone support for since 2023. So some examples of the strategies here are increasing uh, basically the number of people who are signed up for federal assistance programs, and that includes people knowing about it, right? Capacity includes having people be able to sign up, and having the navigators, and then increasing locations that participate in the Double Up Food Bucks. So some examples of successes with that coalition are that we now have 16 newly trained SNAP navigators that we didn't have in 2023. We now have more Double Up Food Bucks locations. Most recently, the what's it called? The Mercado, the Mission Market, is that, I mean, I don't know if I'm saying it right, but Mission Marquee Plaza, there you go, Farmers Market, does have a Double Up Food Bucks vendor at this point. And we're going to keep on working on that. We've got some others in mind. By the way, I cannot see the chat when I'm doing this. So, please, somebody who can read those, if it's directed at me, if it's a question, please jump in and let me know. So we have a lot of partners, including the food bank. I saw earlier that Mario Obledo was on the call. Thank you. The food bank has been vital, along with a lot of smaller partners for this work. Chicho Boys also provides Double Up Food Bucks. Housing stability. So this, you all might know about the strategic housing implementation plan with neighborhood housing and neighborhood housing services department, and we're aligned with what they're doing, but amplifying that work. So just this week, we have released a Housing is Health toolkit for our partners. And actually, when I complete this presentation, I'll go ahead and put those links on. We've got it in English and Spanish. And that's really to help other people that have not been involved in that SHIP work also get involved with some of the same messaging and with being able to provide some of the same information, so that we are, just more powerful, because the word is out there more. And we're really grateful to have a couple of ISDs working with us too, so we're able to reach those families through the school districts. Prenatal care. So this is not just limited to San Antonio, but nationally, more and more people are not entering prenatal care early or consistently, and that has big implications for the health of the mother and baby, and for maternal mortality. Even if you take a look at that SHANA data, you will see the connection or association, because it's not necessarily a proven cause effect, but there's definitely an association between lack of early prenatal care and maternal mortality. So we want to increase people who are just even being screened for pregnancy, right? They go to your agency, and are we even asking about that and then referring people? So hopefully I'm planting a seed in some heads there. And then this group is thinking about how to use their own data to just improve these processes where we're connecting, because a lot of times people will go to a lot of different agencies, not just during pregnancy, but it makes a difference for the pregnancy outcome, and we don't have a bunch of time during pregnancy, especially if people are coming into care late. We don't have a bunch of time to do that coordination. So how can we improve that? And our partners there include the United Way and University Health Baby Bear and a lot of other organizations, some of whom are on this call. So when we presented this to council, the big question was, how are we going to change these really generational, in some cases, problems with some work groups? What are we talking about? And I explained that collective impact is a model that is proven. An example of a collective impact organization would be, for instance, Up Partnership, right? But we've got many others throughout our community, but there are a few things. You've got to have a backbone organization, and Metro Health has a team with expertise on that, and that's the Center for Policy and Health Improvement. You've got to have shared metrics. You've got to have aligned goals around those metrics, constant communication so that you know whether you're meeting those goals or not, or where things are falling out, and share data. I hope I got those right, but I know I got 4 out of the 5 right. So the Center for Policy and Health Improvement is that group of experts that I was talking about. We've been fortunate through something called the Public Health Infrastructure Grant to provide small amounts of funding to partners to help collect that data. I know that's been a real struggle for small organizations, especially in the last year. But if we're not able to see if we're making a difference as we pilot things, then we're just operating blindly, right? So the help that people need to collect data, whether it's through a little funding, whether it's through TA meetings, and then of course the coordination and data sharing. And then we are furiously working on our April report to the community, which will be, this first one will be, let me explain, let me back up for a second. This is the first one because as of December, the Health Collaborative Board agreed to transfer some of this labor. The Health Collaborative and Metro Health jointly hold this CHIP process. But some of this implementation part has been transferred to us as of December. The Health Collaborative still has the steering committee. The Health Collaborative holds the CHNA. But we're going to be responsible at Metro Health for quarterly reports out. And we're going to start with just a wrap up of what's been going on since April. And that first report, not to set too high expectations. I mentioned the struggles that some of the partners are having. So we're going to start with a more skinny report to start with and build up from there. And a little sales pitch for the center there, which is, I think the biggest thing for me is once we start making these relationships, just like the relationship that I started with Anne before and during the pandemic, once we start building these relationships, they stay, right? As long as we're each being good partners. So that has implications outside of these work groups for how we as a community work together. People from other communities always say, boy, what's in the water at San Antonio with all your different collaboratives. And this relationship making and holding, like the intersection like at the intersection is an example of that. And I believe that's my last slide. And I think I only took, okay, that was last week. And I think I took only 10 minutes of my 15. So I'm happy to go over anything else.
Well, look at you, 10 minutes. What I'm excited about are these, which is in the last slide here, the progress reports every 3 months. And I think I understand. You might want to repeat it in case somebody came in later. Why the report we were looking at is 24 and we're in 26. But I do see on this slide how we're building that. And I think it's just one of those glitches in time, right? And trying to get reports and process into sync again. Yeah.
Yeah, yeah. And part of the reason for the transfer to mental health is that we now have the capacity to support, to provide backbone support to, a number of different work groups. Some of these are baby, infant work groups. Some of them have been around for longer. For people who, okay, so I owe you in the chat information about how to join one of these existing work groups. Just keep in mind that they've been in existence and so we'll basically when you sign up, you'll meet with the Health Equity Network staff and they'll just give you more context and then you can make a decision about whether it feels like a good fit or not. Um, I owe you that. I owe you the Housing is Health Toolkit links. And to answer Anne's question, we fell out of sync, but you can see our plan to get back into sync.
Mhm. And the progress reports, where will people be able to find those? Junda, do you know where that's going to
Yeah,
be?
so we are in the middle of working with the Health Collaborative on the Health Collaborative has generously agreed to house that dashboard. And so now I'm in the middle of furiously pushing paper through to make it all happen in time, but it will be in the fall.
Mhm. But through the Health Collaborative. So Liz will
Yes,
keep us posted on that, but
yes, ma'am.
that'll be helpful to all of us. I want to open this up to other questions, comments.
Junda, can I just make mention? So for those of you who are thinking about the out of sync, as you guys know, Metro Health is a public health accredited. It's FAB accredited, and so they've got a timeline. Obviously, many of you guys on the call have participated in the work groups in the past, and I wanted to highlight that mental health has actually been part of the community health improvement plan since the inception of the CHIP. So since the 2012 CHIP that was released, mental health and behavioral health has been a priority area for our community. And we've seen a lot of really great traction in that. At the same time, it continues to be one of the areas that we just need to continue to support. So that's important. The other areas that you saw there, food security and maternal health, originated from food security. Drew was a little bit more refined in the last iteration of the CHIP because it used to be under healthy eating, active living. And so part of the work groups, right, really wanted to hone in into that specific area of food security as a bubbling need. So that's how you see some of these focus areas transition from what they used to be to what they are now. The other one is maternal health. So before, right, we used to have healthy family and child development. And that work group really wanted to hone in on the needs of maternal, of moms, right? Moms and babies, especially with the critical data that we were seeing where we were not faring so well in that space. So again, just know that the Community Health Improvement Plan continues to be a living document. We're super excited about partnering with Dr. Wu and her team to be able to support ongoing work in this area. And so just wanted to acknowledge again that mental health and behavioral health has been at the inception of the CHIP. So this is, I believe, our fifth iteration of the CHIP, if I'm not mistaken, and our 11th needs assessment. So again, they bundle one against the other, but now because Metro Health is a FAB accredited institution, we want to follow suit to the recommendations and requirements of their timelines.
And whether we're talking about it or not, I definitely hear more integration and work happening between county and city. We've not those words haven't come up, but just listening to the presentation and how the work is and where it's going and moving. And that's really important to the community. And I think we all know that. So it's great to just kind of hear that that is working and at work. So Peter, your hand is up.
Yes, thank you, Ann, and thank you, Dr. Wu. Great presentation and great to hear the insight on the working groups with the mental wellness. Had a question about you said the shared metrics and specifically with the mental health, and I saw the 5 poor mental health days as it sounded like that was one. Can you kind of elaborate on that? And I'm assuming that a working group gathers the data and enters it, and how, is there more than that? Because I know we've talked through how do you quantify some of the work we're doing in mental health directly impacting those that we serve.
Yeah. So there's a yes, and so that the number of mental health days is answered through a survey, and that's generally done through. Well, I'll find a link to the way that question is asked if that's what you're looking for. You can do it programmatically. I had a program where we did use that as a programmatic measure. However, remember that for the chip, the measures that I showed you are population wide. So that's going to come from a national survey, and that's why it's going to change little by little, right? So for I thank you, Liz, for the historical context. This came up during the presentation to council. One of the things that you saw get better, one of the things that used to be in CHIPS and is not right now is teen pregnancy prevention. And we've gotten much, much better at that. I have to give some credit to national trends, but also we had the San Antonio Teen Pregnancy Prevention Collaborative, which was also a collective impact collaborative. So they used that population-wide indicator as a metric, but they also just tried to align their own programs and came up with their own individual measures like, okay, how can we see how many schools are providing evidence-based abstinence plus education, right? So what your program will be working on will be different from what that community-wide metric indicator is, but the hope is that that will influence the indicator. Does that make sense?
Yes. So you kind of build out some of the other met indicators that can be factored into the metrics that are already established to show the impact.
That's right.
Okay. Well, that's good to know. I'm glad to see that network's there, and look forward to plugging into it more so. Thank you.
Don't you just love this when the community's talking metrics too? I mean, we've come a long way, and we have a ways to go. Other questions or comments for Dr. Wu?
Dr. Wu, Joe Tiemann, I had a question from one of your early slides. You mentioned something about disinvestment. Would you explain what you mean by that?
Well, how do we begin? I would just rely on the example of redlining because it's the most, I don't know, there's been a lot of conversation locally about that for a while, right? So that means that there were the homes that were redlined in San Antonio, which are still some of our poorest or our poorest neighborhoods. You were not allowed to give mortgages, right? In those because those were considered bad investments, right? So if banks weren't allowed to give mortgages, that is a form of disinvestment. But you can also imagine how that comes across in whether we're building healthcare facilities, whether we're, even roads, streets, things that Cops Metro had to fight for decades ago. What about investment in our schools? What about the Robin Hood bill? Yeah, does that give the
Well,
some idea?
disinvestment means a reduction in the investment, right?
Um, I was thinking about it as not investing, but I see what you're saying. All right.
Rather than non-investment, it's a disinvestment. See, I read it as a reduction in the support that was being given in certain areas.
I see. I am sure that given time, I could come up with examples of that as well. Because when budgets get cut, a lot of times the cutting would happen in, again, our more already marginalized neighborhoods.
Mhm.
Mhm.
Okay, thank you.
The importance of words.
Yeah, yeah, yeah.
Yeah. Other thoughts, questions? Well, thank you, Dr. Wu, for stepping up and being ready to launch this series going forward. We really appreciate you and your leadership and all that you do for San Antonio. I want to thank everyone for coming this morning. I hope you come back next week and tell others. Jessie Higgins with Metro Health will be with us next week, and she'll be reporting on youth mental health and giving that report in of what's happening in San Antonio. So, utilize the recordings, show up, tell others, and let's just keep connecting with this important work that we've been doing here in San Antonio. Thanks all for showing up this morning, and we look forward to seeing you next week at the intersection.
Absolutely.
Thanks, Junda.
Bye, y'all.
Thanks, Ann.